the number 140 over 90. If a number goes above 140 over 90, it's actually considered to be hypertension. Now, the top number, 140, is called a systolic number. The bottom number is called a diastolic number. So the systolic number should be higher than 140, but no less than 100 millimeters of mercury. The bottom number, which is a diastolic number, is 90, but shouldn't be any lower than 60. So 140 over 90 is a target number you want to look at in terms of the blood pressure being elevated. I won't bore you with all the particulars of the different stages, of which there are 3 stages when we look at hypertension in terms of the diagnosis. But it is important for everyone to know that if you went to the office and you saw your provider, one visit in the office with an elevated blood pressure does not in itself constitute a diagnosis of hypertension. You see, hypertension, to make the diagnosis, it has to be on 3 consecutive visits, different visits, with the systolic top number greater than 140 and the bottom number greater than 90. That would then constitute a diagnosis of hypertension. Now, people would ask, well, what kind of symptoms would one have if their blood pressure is elevated and they've been diagnosed with hypertension? Well, when the heart's working harder, that blood pressure goes up, the patient could have symptoms like headache, blurred vision, dizziness, chest pains, palpitations, abdominal discomfort, swelling of the ankles or feet. So there are a variety of signs and symptoms that would certainly make one suspicious of elevation of blood pressure. And that's important to know. And those are symptoms. So then the question would be, what are the risk factors and what are the contributing factors leading to someone having hypertension, high blood pressure? Well, stress of any kind actually can make the blood pressure go up. The other things to remember now also, so with stress, if you are in pain, if there is excitement, if someone startles you, it causes the heart rate to go up and the blood pressure to go up. That in itself doesn't necessarily mean it's hypertension. Then you start looking at advanced age. Now, why is age an important issue when you talk about hypertension? As we become more seasoned in life, the arteries, the vessels that feed blood throughout our bodies become more rigid, so they lose their elasticity. And so because of that, when that blood flow comes across the walls of those arteries, the heart's going to work even harder and the blood pressure is going to go up because they're not as soft and elastic as they used to be when you were younger. So that's another factor that contributes to developing hypertension. So that's risk age. And we look at other issues in terms of what we call comorbidities. So diabetes, thyroid disease, obesity, cholesterol, hyperlipidemia, family history of hypertension. That's very important. It's a big risk factor. Living a sedentary lifestyle, meaning not exercising. Very important. We must exercise. Dietary habits. Now, that's an important one because when we start looking at sodium intake in the body, we start looking at the type of foods that we eat, we recommend that everyone bake, broil, and grill foods. Try not to fry very often. And remember, everything is in moderation. It doesn't matter if you have a cheeseburger every night. Some fries. It would be un-American to not have a cheeseburger and some fries. So everything should be in moderation. That's just very important. Then we start looking at cigarette smoking. And cigarette smoking is the bad guy. Now, why is cigarette smoking the bad guy? Smoking cigarettes causes vasoconstriction of vessels. When that occurs, then there's a reduction of blood flow getting to organ systems and structure. Now the heart's working harder, the blood pressure is going up, and those symptoms I mentioned, blurred vision, dizziness, chest pain, pressure, palpitations, abdominal pain, swelling of the ankles, and feet, those things can occur. Very important. Excessive consumption of alcohol, not a good thing. I won't bore you with all that during this second of the lecture itself, I'll talk to the side and tell you a little bit more about that. But I will spend about 10 seconds on the alcohol hits the brain, and it hits the heart, the kidneys, the liver. And what one doesn't want to have is an alcoholic encephalopathy. I'll explain all that later. An alcoholic cardiomyopathy, where heart muscle's not squeezing adequately, and there's not adequate perfusion of blood getting out to vital organs and systems and structures. Kidneys can fail. Now you're on dialysis. Liver. I think most everyone in here has heard of hepatitis and liver cirrhosis and ascites, when your belly comes out like you're 9 months pregnant, and we have to stick in these 9-inch needles to aspirate fluid off of the abdomen, in some cases put in shunts. These are things you want to avoid. So an occasional social drink, not a big deal. Excessive alcohol consumption, a big deal, as well as the smoking. So very important there. And, we talk about medications. So there are lots of different medications that we use. A lot of times we can actually decrease blood pressure just by dietary habits in terms of adjustments and cutting out smoking and alcohol and exercise. But there are lots of other medications that we typically use and different classifications of them. I won't bore all of that at this second, but I'll to the side I can explain some of those. And so that's important. As a matter of fact, that actually takes me to a little short story that I have to share with you guys when we talk about medication. I have this Uncle Larry. Now, this guy you'll probably laugh at. Now, my Uncle Larry tells me, I am the ladies' man. I am the gift to the human species of women. I said, well, Larry, how did you come to that conclusion? And why do you say that? As he's prancing around with his alligator shoes on, and crimping in the mirror with his sombrero, his hat. Of course, that generation will refer to it as a brim or a lid. So one day I get a call from my Uncle Larry, and he says to me, son, I need you to come over. I've got an issue I need to discuss with you. It's a little concerning to me. Yes, sir. A couple of days later, I go to visit him. So I said, Uncle Larry, tell me what's going on. How can I help? He looks at me. He turns to his left. He turns to his right. As if someone's in the room listening to us and it's only the two of us. He leans in, which causes me, of course, to lean in. He says, son, I think I lost my mojo. I said, Uncle Larry, what do you mean when you say you think you lost your mojo? He says, well, my lady friend's not too happy. So now, I get a good history from him. I do a physical examination. I say I can't really find anything that really points out to me. So I said, what medications are you taking? This is when I was starting to talk about medication. He says, well, my doctor put me on this medication called metoprolol. I said, well, I've been prescribing that for over 25 years. I like it. It's a very good beta blocker, which is the category of the drug. But I said, do you have a heart problem? Because you didn't tell me the heart problem. He said, no, son, I don't have a heart problem. I said, okay, then here's what needs to happen. This metoprolol, although it's a very good beta blocker, it's important for everyone to know every medication has a side effect profile. Whether it's a beta blocker or an alpha blocker, calcium channel, I'll explain all that to the side of your questions on that. In his case, he's on a beta blocker. And I said, listen, that particular medication in a small subset of patients can cause depression, fatigue, bronchospasm, like, wheeze, I can't breathe good, decrease sexual libido, and affect your erections. Did your primary care share this? No, son, he didn't tell me any of that. And here's what I want you to do. Because I assessed his vital signs. His blood pressure was actually well controlled. So I said, you can actually stop this medication for a few days. Go in and see your provider. Tell them that you can smoke with me. Ask them to switch that medication from the beta blocker to something like the calcium channel like I'm loaded. So he goes and does that. Calls me 2 weeks later, and now he's telling me, son, my lady friend is happy. So there you go. So certain medicines can actually cause different type of reactions on your body's organ system. So that's why it's very important to actually share with patients when you give them a particular medication, things to look for, if they ever have signs or symptoms, to bring that to your attention immediately. That's very important. Now, as I mentioned, when we start talking about the treatment and medications, and diet, exercise, weight control, then we start looking at diagnostic evaluations. We always recommend that everyone go in to see their primary care at least once a year when you turn age 50. Now, if there's family history, you may want to go at age 40 or age 30, hypertension. So when you go in to see your primary, and most of everyone in this room has probably already seen a primary care, and you're going to end up with an EKG and some blood work and urine, and they may have to do a stress test. So all these different types of studies, and even a two-dimensional echocardiogram, an ultrasound of the heart, when we assess a pregnant woman and we're evaluating the fetus. So those are the typical type of tests diagnostically that we're going to do to determine whether there's some other explanation for the blood pressure being elevated consistently and then you're being diagnosed with hypertension. Again, for the diagnosis of hypertension, you have to come in on 3 separate visits. That top number over 140 and the bottom number over 90. So that's important. So